Hello, I'm Dr. Mark Menelacino, Medical Director of the Mental Clinic in Jackson Hole, Wyoming. Thank you for joining me for the Heart Solution for Women from the front lines of functional medicine. Today, we're going to learn all about how to protect the heart for women, achieve optimal health, and reach that high level of vitality by balancing the symphony of the thyroid, adrenal, and gut. The heart is a very complicated organ, but repairing it is much more difficult than preventing damage in the first place. The problem is we got it wrong. We do not treat women the right way in diagnosing heart disease, in treating heart disease, and especially in preventing heart disease. Women and men are different, and for years we've treated men and women the same. Now we're changing that with the Heart Solution for Women. I've always said if you're the smartest person in the room, then you're in the wrong room. One of the goals of my career is to work with the people who know more than I do and to be humble in that knowledge and to share. One of the beautiful things of functional and integrative medicine is that we all work as a tribe to achieve optimal health for you. Why is nutrition so important? Even the US government has shown us that the population is not meeting dietary nutrient recommendations. Even 68% of us don't get enough magnesium. 85% of us don't get enough vitamin E. Many of us are depleted in our minerals, and we're depleted in those nutrients, then food can't be medicine because our soils are depleted and the foods just don't carry that nutrient density that they used to. Many people take supplements and we wished that they looked like this. I'm a big fan of letting food be your medicine and using targeted supplements because they're called supplements for a reason. They supplement a healthy nutritional plan. But sometimes you do need a little extra help to overcome those genetic variabilities, those lifestyle challenges, those rampant toxicities. So I do think that targeted supplementation makes sense. The problem is a lot of people are getting substandard quality, and some of them don't even break down in the digestive tract. These are substandard multivitamins that weren't even broke down. You can see they still are hard shells intact in the small intestine. Why is this so important? These are research mice. This is the mother in the orange and the daughter in the brown. These are genetically identical mice. In the mom, you can see that she's obese. You can see the cysts on her side for cancer, and she's also diabetic. Her daughter is the exact same genetic mouse, but we fed the mother some special nutrients to help to overcome her genetic deficiencies, and lo and behold, her daughter has no cancer, no obesity, no diabetes, even changed the coat to a healthier color. We call this concept epigenetics. This is how environmental factors can change the way our genes function. I'm here to tell you that you are not your parents. You are not to be doomed to the health illnesses that run rampant in your family. You have the power in lifestyle medicine to change your future. We talk about this concept of epigenome. It's the pages of the book, of your book of life. It's the software that tells your DNA how to function. What we can do though is a food that you bathe over your genes, you can turn on good genes and you can turn off bad genes. You are not your genetic destiny. And that's one of the most powerful things I can share with you is you have the ability on the end of your fork in your other lifestyle choices to change what your genes want to express. Again, looking at the yellow mouse, which is obese with higher cancer, diabetes, obesity, reduced lifespan, just by giving mom some zinc, methionine, choline, folate, B12, some common nutrients, you change the outcome of the offspring with lower cancer risk, diabetes, and obesity. We knew this over 100 years ago. One of our famous doctors, Sir William Osler, told us that it's much more important to know what sort of a patient has the disease than to what sort of a disease a patient has. It's about the person, not the illness. And we've forgotten that in modern medicine, and we need to go back to really look at what is this individuality, look at a precision, personalized care model. Well, doctors sometimes get it wrong, as some of the smokers in the past, but we also got it wrong with some cholesterol fallacies. We used to think that if high cholesterol is genetic and it's poorly responsive to diet, it's incredibly responsive to what you eat. We thought that the correct diet for cholesterol reduction was a low cholesterol, low fat. It's much more complicated. It talks about good fats and bad fats. We also thought that lowering cholesterol was the main way to reduce your heart disease risk. Now we know that nearly half the people that have heart attacks have normal cholesterol levels. We were also told that coronary artery disease is rare in people with normal cholesterol, and we know that that's just not true. We tried to develop these guidelines, which is what I call paint by numbers medicine. Look, we're all individuals and we've got to be treated as individuals. We can't group everybody the same and treat them as a regression to the mean of a population. Don't be average anymore. Try to be optimal. These cholesterol myths, we used to think if the total cholesterol and the bad were normal that you didn't need to worry about heart disease. Not true. We were told if you exercised and ate healthy, you didn't need to worry about it. Not true. Especially we were told that women aren't as susceptible to heart disease as men. Well, we now know that heart disease kills more women than all cancers combined. They show up different, they present different, and we need to treat them different. We were also told that routine cholesterol tests gives you an accurate measurement of your bad cholesterol. That's not true, and I'll show you the tests you need to get. We also were told if the good cholesterol is high, then I'm more protected. And again, this is one of the myths that we used to have about cholesterol. We're going to break all those myths today and show you that there's a better way to look at it. Yes, it's going beyond the traditional type of cholesterol testing and looking at these patterns and these fractions. Look in the middle at the little LPA in parentheses. That's the dreaded lipoprotein A. That's the test every woman needs to get because that's the silent killer for women. It's a nasty, sticky little particle with an inflammatory tail on it. That's the one that makes the inside of the heart arteries irritable and makes the plaque want to rupture, and that's what causes the heart attack. In traditional cholesterol testing, best case, it's only 40% predictive if we use what you're getting currently. The health fair model is 1975 based, and it just does not tell us the story anymore. We've got to go beyond the health fair and do the fractionated cholesterol. Even the Framingham study showed us that we have people that have 35% of heart disease happens in people with a cholesterol that's supposedly normal. So again, these numbers that we use, this paint by numbers medicine, just doesn't work. And if you think you're safe with a cholesterol under 200, that's just not true anymore. This is what we're all trying to avoid. This is an electron micrograph picture of a heart artery getting ready to rupture. And when it ruptures, it forms the clot. So it's going beyond the cholesterol testing you're getting now and looking at these fractionated cholesterol particles, particularly the lipoprotein A or the LP little a in parentheses, and the different pattern sizes. The problem is that we're all worried about that bad low density cholesterol, the LDL cholesterol. Well, when it's calculated, you may or may not have a risk because when you look at the breakdown patterns, you can see there's 4 subtypes. There's that LPA or that lipoprotein A in the green. That's the most dangerous one. That's the one inherited, and it's resistant to the cholesterol drugs. So you could be taking a drug for cholesterol and it not be doing anything. The other are the small dark red marbles. Those are the small dense LDLs, and those are the ones most likely to want to cause a plaque. So all cholesterol is not even. A cholesterol 200 is not safe anymore. The LDL really tells you nothing. You've got to get these particle sizes, and for women, really look out for that LPA or lipoprotein A. Because it's more complicated than cholesterol. This is a diagram of the inside of your heart artery. And what we know is that even 19-year-old kids on autopsy have plaque generated. Even in your teens, you have a little bit of plaque. But who's got a vulnerable plaque? Who's going to have a plaque rupture? You know, I thought in medical school what happened was your heart artery, that it was a plumbing problem. That if you just filled up the pipe with too much cholesterol, there was no room left and you had a heart attack. That's not what happens. Whether you have a small plaque or a large one, if it becomes irritated or inflamed and becomes vulnerable, then you get the plaque rupture. The platelets, whose job in the blood are to fix cuts, they rush in to fix that rupture. They overreact and fill up the whole pipe. Boom, heart attack. That's the mechanism of what happens. So what we don't want is to start generating that plaque growth, and that's the CRP there we see at the top of the diagram. And what we don't want is to have a vulnerable plaque that might rupture, and those are the two tests, myeloperoxidase and plaque 2. Those are the two that are the most likely to be involved in plaque rupture. So guess what? What you're getting for your testing for your heart risk is almost worthless for you, especially as a woman. You've got to get the fractionated test we just saw with the lipoprotein A, and then you've got to get these high-end advanced inflammatory markers, CRP, myeloperoxidase, and plaque 2. If those are in a normal level, your risk is almost zero for a heart event in the next 12 months. If those levels are high, then you're greatly at risk. And these are the women and men that do everything right. They eat right, they exercise right, they meditate. They are the people that you think would never have a heart attack that drop dead when they're hiking or when they're skiing, and no one knows why. It's because of those bad particles, that lipoprotein A, and it's because of these inflammatory markers being sky high, the myeloperoxidase, plaque 2, and CRP. And you can find them. You can test them. It's not expensive. It's a simple blood draw, and you can find these canaries in the coal mine. I want everybody to get this testing. There's another protein you can test for called homocysteine. It's a fancy word, but just think of it as a toxic protein. It's an amino acid that floats around in your blood, and it's an independent risk factor for heart disease and Alzheimer's. It chews on that vulnerable plaque area to make it more likely. When you combine those bad particles with the inflammatory myeloperoxidase CRP with this homocysteine, then you've got the trifecta of risk. And so we want to look at all of them in everybody to find who's at risk and reverse it. That's the beautiful thing about personalized precision lifestyle medicine and the functional medicine model. We can find these people and we can fix them before the problem happens. This is not just my opinion. This is way back in 2008. Even on Business Week was coming up with the comment, maybe these statin drugs aren't as good as we thought. There were commercials that we thought everyone should take them. My medical school teachers thought they should be given out with fast food, that they should be in the water. Now what we're learning is that they are powerful drugs, but the benefit is limited to a very narrow group of people. And the problem is in America and now worldwide, since we're exporting our lovely fast food all over the world, the rates of heart disease and diabetes are skyrocketing. So we find that it's common nature to drive around the parking lot till you get that parking space right up in front of the fitness gym, then take the escalator up. Well, yes, you have to do some heavy lifting. You've got to want to have some self-care, but it doesn't have to be impossible. You don't have to become a marathon runner to have good health and prevent heart disease. You've got to do, number one, the right tests. Number two, have the right discussion with the doctor who's trained in this. And number three, be willing to do some self-care. But we will show you the way, and it's not that hard. The beautiful thing is it's letting food be your medicine. It's finding what's right for you to eat, eating the good things and less of the bad things. So Hippocrates was one of my favorite people. He taught us that food is medicine. Well, we were talking about this concept of epigenetics, how you can turn on and turn off bad genes. So that means food is now information, and you turn these genes on or off. Louis Pasteur, who invented antibiotics, taught us it's not the microbe, but the soil. When the soil for humans is stress, mood, nutrition, gut. We find in people that have a gastric bypass, it's fascinating how their cholesterol markers, their blood sugar markers, diabetes markers, all shift within a week of their bypass, even though they haven't lost the weight. So you can change the metabolism of the body and of nutrition even before you lose the weight. Now, if there's one thing I could put in a pill, it'd be the Mediterranean diet. It lowered all-cause mortality 50%. It means reduced death in half the people that adopted this nutrition plan. If that was a drug, it would be $1 billion drug. The best any statin trial for the limited population tried in was only 30%. So again, Mediterranean diet, which is the focus on whole grains, foods that have low fat, good fats, the olive oils, the avocados, looking at the lean meats, the fish, the poultry, the lean cuts of beef, really trying to eat as a social support, eat with a family, eat with a group of friends. The Mediterranean diet seems to be, of all the ways to eat, the best for affecting your heart risk. Well, it's all about the omega-3s. If there's one thing you should take as a supplement, it's an omega-3, but take the highest quality. A lot of my patients come in as a new patient with fish oil they can't even hold next to them because it's rancid when they buy it. Don't buy bad fish oil. Try to spend the extra few dollars on a high quality fish oil. It should not smell fishy or it's already rancid. It's been shown to prevent just about everything. It's an anti-inflammatory. It reduces heart bad rhythms. It reduces blood clots. It reduces blood pressure. All of these other benefits that you get from omega-3 are clinically proven. We also know that there's other things that you can do by reducing this sedentary lifestyle. Just go for a walk, do it with your pet, do it with someone you care about, but don't do it alone. This depression, this anger, hostility, response to stress, it's really trying to have reduced stress and find some joy in your life. Toxins are everywhere. The BPA they talk about in plastics, a lot of the heavy metals that are in our environment, that are in our soils and our foods. Really try to eat clean food, drink clean water, breathe clean air. Social isolation, lack of social support, that's why women live longer than men. They're more social creatures, and really nurture the social people in your life. Nurture your family, nurture your friends, nurture your pets. And there's this concept of adverse childhood events that's really seeming to play out for both men and women, that what happens to children may have a great impact on their health later in life. And this is why you really need to take care of yourself, the people you care for, and look out for others in your life. It is all about the magic of food. And again, food can be medicine, food can be information, food can be magic. So, quiz time. What's the number one risk factor for a sudden death heart attack after someone has their first heart attack? Everyone says, oh, it must be cholesterol, or it must be those bad particles, or that lipoprotein A, or those inflammatory markers you talked about. No, it's depression. Depression sets up this inflammatory state that makes your second heart attack much more likely to kill you than a first heart attack. So while we're talking about heart disease risk, this is not just my opinion. Even Time magazine picked up on this, that it's really all about inflammation. All of these things you see here have inflammation at their core. And the biggest thing about heart disease, particularly for women, has nothing to do with cholesterol. It's all about inflammation. And if you have that nasty lipoprotein A in addition, then you've got the synergy that makes you incredibly at risk. So we want to look at all of these things that drive inflammation, that drive all of these other conditions. It's really nice when in my clinic I can fix one thing that has all of these other downstream effects. Even the American Heart Association sees that these are all in common. Oxidation, inflammation, this is the fire in the body, and it's driven by all of these: lack of exercise, obesity, poor diet, high cholesterol, depression, high blood pressure with the stress on the artery, and smoking. These are my yard friends that live in our yard every summer. We're in Jackson Hole. And my point is, look at the coat of the mom and of the babies, the foliage around them. You are a product of your environment. You are what you eat. Food is medicine. Clean air, clean water, clean food. So be good to your body and let your body show the benefits. What you don't want to do is to caramelize your cells. These are the famous sticky buns. You might as well just put a hook on it and set it up on your belly. But these high sugar foods drive insulin, and that insulin is what caramelizes the cells. It's called glycosylation. And this is the fire of inflammation that's driving the heart disease and the brain disease in our world today. So I do this for the elementary and middle schools in our town, where I show the kids just exactly how much sugar they're drinking. And by the time we get up to the one on the far end, even in the middle, you're talking about a lot of sugar, and kids have no idea how much sugar they're drinking. They go home and tell their parents. So this is something you should ask your physician or your school nurse to do for your kid's school, or sit down and show them this slide. I like to start with an empty glass, put some water in it. Then with every one of these drinks, just start adding the tablespoons of sugar until you get to the end. It ends up being a full glass of sugar. And that just really is a great mental image for kids to know. And also for us, we're just getting too much sugar. And this is what happens when we do. We go from warrior, thrifty, healthy genes to these obese genes. And as a doctor who cares about you, it's none of us like the fat on the outside, but it's really the fat on the inside that scares me. It's what we call this visceral fat. The subcutaneous is the fat that you can pinch if you pinch your belly right now. That visceral fat is the fat that wraps around your organs, that's internal, that wraps around your liver. It's the hot, inflammatory fat. That's the fat that scares me. I see many women that are what we call skinny fat. They have a lean body mass, they look great on the outside, but when we look at the inside, they have a very high visceral or fatty fat or internal fat. This inflammatory visceral fat is really the one that scares me the most. And a lot of it's driven by your blood sugar. And this is a sample of a blood sugar curve, and the GI is for glycemic index. Every carbohydrate has a number associated with how high it wants to spike your blood sugar. And if you look at this, a piece of steak is low glycemic index because your blood sugar doesn't rise much. That's the orange bar, versus a donut or a sticky bun that rises your blood sugar quite quickly. And you'll notice it can then drop your blood sugar. And so a lot of people will get these low blood sugars throughout the day because they're having high blood sugars. And it's the high blood sugar that drives insulin, that drives that hot fat, that inflammatory internal fat. So really looking at the foods that you're doing. And it's a really pretty simple thing to do, is just to find, and there's a website there to go look, what foods that you might be eating that are very high in the glycemic index and try to reduce them. One of my simple tricks, and I don't really believe in diets because the first three letters are die. I believe in personalized nutrition plans. You can develop a nutritional strategy that tastes great, is a wide complex and range of nutrients, but also is low in this glycemic index. And one simple way is always to think about, where's the protein that I'm eating with the starch? So have a little nut butter on your carrot or on your celery. Have a little avocado with your burger, or with your sandwich with the meat and with the cheese. Try to add some of these good fats to it, some of these proteins to it, and that'll help reduce the high sugar load. Another simple thing to lose weight and to get rid of this blood sugar is that, did you know that a slice of bread is seen by your body as a can of soda pop? The sugar load in a slice of bread has the same amount of glycemic index as a can of soda pop. So how many servings of bread have you had in the last week? That includes bagels, muffins, sandwiches. So try to reduce just the simple bread volume you're taking, and that might be a simple way to drop a few of those pesky pounds. Now, when you throw a hormone imbalance, some nutrition imbalance, a little toxic environment, some depression, mood disorder, that's why so many people are sick. Well, we live in a beautiful place, and the only stress is going to the airport in the middle of the day and catching your flight. That's not actually true. There's a number of things you can use as nutraceuticals. At the bottom, red yeast rice extract is one of my favorites. Above it, niacin, you have to be careful with. Some people have a reaction to it. But everything on this list in the right high quality form has been shown to adjust cholesterol levels, but it's not a one size fits all. Certain things work for certain people. Well, what is this concept of functional medicine? It's this personalized precision approach. Optimize nutrition, balance hormones, reduce inflammation, fix digestion, enhance detoxification, boost energy metabolism, and calm the mind. That's why we have books like this, because so many people have thyroid problems their doctors just can't figure out, because it's complicated. And if you're looking at one piece of the symphony, then you may miss the whole story. So you need to find someone who's adept at looking at the entire story. There's this mystery illness out there called adrenal fatigue. I'm here to tell you it's real. I like to call it adrenal dysregulation. Those are the people who are sick and tired of being sick and tired, or they're also tired and wired. And it's a real issue, and it's stress that drives it. It's the stress in our environment. It's the stress of your job. It's the stress of your toxicity. It's the stress of your relationships. So really try to look at how to de-stress the body. There's a concept called leaky gut, which I wasn't allowed to talk about in medical school. It's now scientifically called intestinal permeability. A great article by Anthony Fasano in Scientific American in 2010. You can look at this. This is what drives most of the inflammation in the body. You can actually test yourself, see what foods in an IgG food panel are the ones that are reactive to you. Here's someone where dairy and gluten probably is not their best choice, and maybe driving this malabsorption of the gut, or damaging the lining so that you don't get good nutritional absorption. This is what leaky gut looks like. The lining of the gut is broken down and you just don't absorb the nutrients. Even if you eat high quality foods, you're not getting what you need. We talked about all these other risk factors, and again, mood, but look at the toxins there in the middle. That's one of the biggest things that's a risk factor for the heart. And we know stress, some stress is good, some stress is bad. There was a 25% increase in heart attacks the day England lost the penalty shootout in the World Cup. So stress is real. You've got to balance all the other stressors in your life. You've got to have social support. You've got to have love. You've got to have this balance. Then you can tolerate that extra stress. There's a tool called Heart Math, which is a heart rate variability. It's this idea that when you're stressed, your heart rhythm is very erratic and irregular. When you're in a coherence or feeling positive emotions, the heart loves it. That's why yoga, meditation, imagery, deep breathing, journaling, all of these things that we're told that help us really do. And what they do is they set up a good balance for the energy of the heart to help you cope with the stresses in your day. Do you remember how we used to be talking about this fight or flight response? Well, it's what saved us when we were cavemen and cavewomen from a saber-toothed tiger. And I'm sorry to tell you, for all the people listening, you are still a caveman or cavewoman, and we're still responding that way. Your body does not care if you have reproductive hormones if you can't have adrenaline to run from the saber-toothed tiger. So a lot of people have this cortisol steal, or their adrenal glands will rob all of your hormones to feed into your adrenal pattern. And then the toxicity. We had this in my neighborhood. This is insecticide. They would drive down the neighborhoods to try to kill all the mosquitoes. And when you throw all of this in the mix, it's no wonder why we're sick and tired of being sick and tired and have this issue with inflammation of the heart, of the brain. And it's really trying to balance the hormones, finding optimal nutrition, reducing your toxicity, and addressing any mood issues in your life. Well, don't forget about these toxins. We know that lead and heart disease, look at that, 55% increase in heart disease, 89% increase in myocardial infarction or heart attack, 151% increase in stroke, and this is just for a very low lead level of over 2. It affects almost 40% of our population. So this is the smoking gun in our world, is toxicity. And again, clean food, clean air, clean water. I encourage everybody to go to the Environmental Working Group. It's ewg.org. They have the Dirty Dozen and the Clean 15. You can find the foods that you should be feeding yourself and your family and the foods you should avoid at all costs. Get rid of those toxins in your world. And let's let food be medicine for the heart. And I want to just give you a peek for the brain too. We know that there's a new program to reverse cognitive decline. Yes, I'm talking about dementia and Alzheimer's. The same program that Dean Ornish showed reverses heart disease that we're showing you here, that reverses heart disease, prevents heart disease, you can do the same for the brain. It's the same personalized precision program. And one of the keys to it is having this collaborative care team where you work with a physician who's versed in nutrition, that communicates with a health and wellness coach, that has a nurse that's supportive, that has nutrition and physical medicine and exercise as part of your care plan. You don't have to do all of this, but know and find the resources, and we're here to help you be successful. Thank you very much. And come visit us at thementalclinic.com for more bonuses, more gifts, and more insights how to become the best you can be. 3, 2, 1, out.